knocking on the door, and before I did that, I would know what the policy and the procedure is for doing a head-to-toe assessment, what all it involves, what systems, and I would check for doctor's orders. And I'm looking for things like patient has to lay flat, so I wouldn't be turning them and moving them to assess them. So I wouldn't be contradicting physician orders. So I know the doctor's orders, I know she's allowed up, she's allowed to turn, and I know my policy. So I knock on the door, and they say I can come in, so I come in, go over to the sink and wash my hands, or if I have a little bottle of sanitizer in my hands, then I can use that. But I wash my hands right in front of the patient so that they know my hands are clean. And I would say, hi, I'm Miss Eldridge, and I'm going to be your nurse today. How you doing? Good. Doing good? You having any problems right now? No. Okay. Is it all right if I check you out from head to toe real quick? Okay. I'm going to just probably uncover you, and I'm going to check pulses. I'm going to check your feet. I want to take your socks off, too. I noticed you had socks on. So let's get your socks off. And if your nose runs like mine does, just use your hand sanitizer, okay, before you check them again. Okay, so you're doing okay, no pain, no problems, right? Okay, so I'm going to just check your hair and make sure that you have any sores or any lumps or bumps or anything on your scalp that's bothering you. No. Your hair's pretty nice and shiny. Okay. Any problems with your ears? No. No pain. Okay. You always look at the tops of your ears to make sure you've got no sun damage and things that develop from that. How about your neck? Any sore areas here? No? Not had a recent cold or anything. Okay. So I just want to look in your eyes, and I'm going to dim the lights in the room so that I can see the difference when I use the light. So I'm going to dim the lights, so we'll pretend that I did that, and I'm going to tell the patient to just look straight ahead at me, and I'm going to start over at the side and look at her pupils, okay? Now I'm going to do the same over here. And I'm looking to see that they're equal and they're round and that they react briskly. And I can use my little sort of cheat sheet that's right here on my pen light, and she's a 5. She's about 5 millimeters. So I would document that Perla 5+. And that means that it was 5 millimeters and her eyes were normal. So I would tell the patient that. Then I would look in her mouth, and I have a tongue blade in my pocket, and I just got this so it's clean. And I said, I need to look in your mouth, and I need to look at your nose, so I just need you to do what you're doing there. I'm going to use this tongue blade and just look. No problems with teeth. Okay. And then I'm just going to look in your nose to make sure your membranes look good, and you look fine. Okay. Now, do you mind if I listen to your heart and your lungs? Normally, on a real patient, you would skin to skin. I mean, you want this on the skin, right? You don't want it on clothing, because you've learned how it rattles and moves and makes noise that distracts you. But for her, I'm just going to place it up here, and I'm just listening for murmurs or rubs or anything abnormal. If I couldn't hear her apical, I could have her turn on her left side, and that would bring it closer so I could hear. And I'm also going to listen to the heart up here and over here for the aortic and the pulmonic valves. Okay? Now I'm going to listen to her lungs, and I'm going to ask her to sit up for me. And again, this would be right on skin. I'm going to instruct her to breathe in and out slowly through her mouth. Good. her side to side. Okay, I'm going to listen around the armpit area to make sure I get all the lobes, especially the right middle lobe over here. Okay, you can go ahead and lay back. And just a couple more deep breaths. Okay, you sound good. So I've already checked her heart and I've checked her lungs. Next is her belly. And I would again do this with the belly exposed, and I would also have checked her chest and breasts just visually. We're not going to have you do a breast exam or testicular exams, anything like that. That's for the physician or the nurse practitioner. Our head to toe assessment is going to be focused on heart sounds, which we would document S1, S2 if it was normal, lung sounds, and I'm going to check her abdomen. I'm going to listen to the 4 quadrants. And we always inspect first, so I would have the gown pulled up, and I'm going to put her, is it all right if I lay you flat? Okay. Okay, and I'm going to listen to the 4 quadrants. I'm going to start over in the right lower quadrant and listen for vowel sounds. And sometimes it takes a while to hear them, and that's normal. It should be like a tinkling sound. And you would have to listen for 5 full minutes to say they don't have any vowel sounds. Okay, then I'm going to move up, right upper quadrant, just go counterclockwise. It's just my routine. Okay, so after you look and you listen, the next thing you do is it all right if I just push real, I'm just going to push real softly on your belly, and you're looking for any lumps, bumps, painful areas, or masses. All right? Okay, so that's that. I'm going to check your pulses now. I'm not going to count them, I'm just checking for quality. And I say that this is a 3+ radial. So let me check on this side. 3+, okay. And I'm just going to check your carotid. It's good and strong. And with her at, I'll sit you up a little bit. She has to be at least 30 degrees for me to check her jugular vein distension. So I'm going to put her head up, and I'm going to say, just rest your head back for me. And I just look at both sides and see if there's any standing out rope-like things here that would indicate that she has distension of her jugular veins. And the reason that we check that is it can be an indication of heart failure. Okay, so she doesn't have that, so I would write JVD negative. Okay, so 3+ for her pulses. And then for a real patient, I'd have my gloves on, and I would check their genitalia. And if they had a foreskin, you would have to pull the foreskin back, check the penis completely to make sure there's no sores, no drainage or anything abnormal, and then put it back the way that you found it. And for women, you just check front to back and make sure that everything's okay. So I've done the perineal area. And now I'm going to move down to peripheral pulses. All right, and I'm going to check the dorsalis pedis, top of her foot. Remember, make a line between the great toe and the first toe, and come back right up. Usually it's right around the top of the foot. I would call these 2+. Okay, now I want to check her posterior tibial. And you just kind of curl your hands around the ankle bone and check the pulse, and it's called the posterior tibial because it's an artery that runs posterior or behind the tibia. So you check that. Again, 2+. Okay, and she has warm feet, good color. I'm going to ask her to, I'm going to push back on her feet. I'm going to ask her to push down on my hands. I'm going to try to stop you. I want you to push down like you're pushing on the gas with both feet. Okay, good. Now try to pull your toes up, and you resist that and see how strong they are. And she's good with that. She has good strength. Can you lift your leg for me? Okay, now lift the other one. Good. Any pain when you move or bend? No. Okay. I just need for you to grip my fingers. Good. Okay. Equal grips, strong grips, that's good. And then I would ask some sensation, or excuse me, some orientation type questions like, can you tell me where you are? Zanesville. Okay. Where in Zanesville?
Mideast.
Okay. And can you tell me what time of year it is?
It's fall.
It's fall. Okay. And who's our president? Okay. Do you know the date?
September 29th.
Okay. If I took 3 away from 10, what would I have? Okay, so to me, she seems perfectly oriented. We call that alert and oriented times 3 spheres. Person, place, time. Okay? She's alert, she's oriented. What about her behavior? We could say she's pleasant and cooperative. That describes her, okay? I would get a full set of vital signs, and that would be pulse oximeter, respiratory rate, apical pulse, radial pulse, and blood pressure. Did I miss anything? If indicated, there's more details that you can go into, like their, the Snelling chart, if you're worried about their eyesight. That reminds me, I didn't check for accommodation when I was looking at her pupils, and I forgot that. So what I want to do is just have her, if you could, just look straight ahead. Okay, now I want you to try to focus on this as it comes in. Okay, and they should get a little bit cross-eyed when you do that, so that's normal. Okay, so I think that's it. Any questions? Is there anything that didn't get covered that you wanted to know about, how to do? Yeah.
What about like her back and checking for like pressure ulcers and stuff?
Yeah. That's good. Their skin integrity, very good. Her color is, I'd say pink, and her skin's intact. And to check for turgor, all you have to do is just gently pinch and see that it goes right back down, which it does. In our older patients, sometimes it tends to stand up like a little hill. And when I checked her, when I did my perineal assessment, I would be looking at her bottom. That's a good point. Skin integrity is huge in long-term care, that we check that. Anything else? Okay, so after I'm finished, I would make sure that I didn't put the bed up, and I didn't do the A through H part, all the things that we do for every skill, and I should have gone through those steps. Pull the curtain, put the bed up. This bed it's not that low, so I was fine, but I should have put it up. I should have pulled the curtain, should have put the bed up, right? So I put the bed back down, and I would put the curtain back the way I found it, and I would put her over bed table here with all her belongings just the way I found it. If I had shooed out her family, I would have them come back in, and I put the bed back down and ask her if she's comfortable, give her her call light, wash my hands, and then go and document. Okay, that's it.